The other question that really comes up a lot is, do you do this procedure under local anesthetic? Now, I know that, general anesthetic has had a bad rap over the years, and in general, if you ask patients, what do you prefer? Do you prefer local anesthetic or general anesthetic? The chances are the vast majority of people will probably say, oh, I want a local anesthetic, because they usually think of it as being much smaller in intensity, severity, recovery, whatever. The truth is a little bit more complex than that. And there are other issues that one needs to understand. Sure, if you're having a small little mole off your hand or somewhere on your body, you don't need to have a general anesthetic because it's such a small area. You can inject it with a local anesthetic, make it numb very, very easily and simply, and do the procedure, and so the patients can go off straight away. However, in a larger area or a more sensitive area, such as the chest, for example, it's not easy to make that area numb so the patient can sit still and you can operate on them without sort of injecting the whole area quite substantially. Now, just imagine you got this whole area of the chest. You got to make that whole area numb so the patient doesn't feel anything. The only way you can do that is to put a very long needle throughout the whole area and inject it, slowly, effectively getting all the local anesthetic solution in it to make it numb so the patient can sit still. The only problem with that is that it's a rather big needle, and so you will feel a lot of that going in. So, the whole process will be, perhaps to some people at least, it'll be slightly traumatic, that whole sort of injecting process. And even then, you will still have that apprehension possibly, that you're going to feel something, you might move, you might twitch a little bit. So that could have implications on how the surgeon works, because the last thing you'd want is to start moving around or twitching when a surgeon is operating and trying to concentrate to do his best. So in that situation, I always say it's usually best to offer a general anesthetic, albeit a very short one. And just because we're saying you're going to give you a general anesthetic does not mean that you're going to have a very long operation. It's going to be a long, arduous recovery. I'll be groggy for ages and won't be able to go home the same day. None of that is true, because you could have a very short general anesthetic, where you wake up immediately after the procedure, you have something to eat and drink within an hour, you're able to go home another hour later, and so it's really no different to having an extensive local anesthetic procedure as well. Now, the thing is, though, not all clinics can offer general anesthetic. And so what they do is they then offer you a local anesthetic, because simply put, they're not licensed to offer a general anesthetic. In order to offer a general anesthetic, you have to have certain backup facilities in case of any emergency. And those facilities in many clinics don't exist. And so therefore, they're not licensed. And so because they can't offer you general anesthetic, of course, they were going to gloss over any sort of disadvantage of local anesthetic and tell you, oh yeah, I can do it under local anesthetic. And because on the whole, local anesthetic appeals to most people, if you like, more than the general anesthetic, they say, I'll have a local anesthetic. It's better, but it's not necessarily the case. So you need to understand all these variables and issues before you fall for I'll just have the local anesthetic because it's easier. It's not always the case.